am Amanda Podolski, a breast medical oncologist at Valley Medical Group and Valley Mount Sinai Comprehensive Cancer Care.
And I'm Eleonora Teplinsky. I'm the head of breast medical oncology at Valley Medical Group and Valley Mount Sinai Comprehensive Cancer Care. And we have some questions from the community that we want to address today.
Who's at risk for breast cancer?
So anyone's really at risk for breast cancer. So just by being a woman and getting older, you are at risk for breast cancer. And men will get breast cancer as well. So that's a population that we don't necessarily want to ignore. But in general, there are certain risk factors that we want to keep an eye on. So the first two are family history and genetics. So having a genetic mutation such as BRCA1 or 2 or other genetic mutations may increase your risk for hereditary breast cancer. And then there are both modifiable and non-modifiable factors. The non-modifiable factors include things such as when a woman started to get her menstrual periods, when she went through menopause, how old she was with her first pregnancy, whether she breastfed or not, things like that. The modifiable risk factors include alcohol use, nutrition and diet, and weight and exercise. And we'll talk hopefully a little bit more later about how to reduce those risk factors. What are the symptoms of breast cancer?
So really they can come in any kind of form. I would say the main thing is when you have a persistent change in your breast that doesn't go away, doesn't vary based on your periods. It's somebody has able to feel a new lump in their breast, if there's a change in the shape or size of the breast, if there is any new changes to the nipple, like crusting or skin changes on the nipple, if there's any increased nipple discharge in somebody who's not breastfeeding. These are all different things that, again, if they persist in nature, are concerning that a woman may have breast cancer. It is important to note that often breast cancer doesn't have any symptoms, and I think part of the purpose of screening is that we detect it at a point when you can't feel anything. Just because you have something seen on mammogram doesn't mean that you would have had anything felt or seen before imaging.
And to add to that, a lot of people will say, well, I had a mammogram, and I didn't feel anything, like you said. Mm-hmm. And most often you won't feel anything because the mass has to be very big in order to feel it. And so this is why it's so important to get your breast cancer screening, even if you've had it a year ago. You really want to continue that regular surveillance so that it allows us to detect things before they get big and at a much more advanced level.
So feeding off of what you said before, how can I lower my risk of getting breast cancer?
So there are a couple of things that anyone can do to, again, decrease those modifiable risk factors. So the kind of 4 things I like to think about. First is alcohol use. 1 drink a day will increase your breast cancer risk by 10%, and that really can add up quickly. So we recommend about 3 drinks a week or less of alcohol. The second is exercise, and the recommendation is 30 minutes of moderate activity, so something that's getting your heart rate up 5 days a week. And I always tell people that you don't have to do all of that. Anything is better than nothing, so start slow and work your way up. The third is nutrition and dietary choices. We do want to focus on eating more plants, less processed food, less processed meats such as bacon, deli meat, and sausages, and less red meat. And the fourth is being at a healthy weight and avoiding significant weight gain during menopause. What kind of breast cancer screening is available, and when should I do it?
So the main screening modality that we use for breast cancer is a mammogram. There are really 2 main types of mammograms. One is a 2D and one is a 3D mammogram. A 2D mammogram is essentially just taking 2 x-rays or pictures of each breast, versus a 3D, which is basically taking about 100 pictures of each breast and really gets a more nuanced picture of the breast. At Valley and at a lot of other imaging institutions in the area, 3D is really the only mammogram of choice, and it really has become more mainstay of imaging or screening. In terms of who should get screening, so our recommendation is to start screening at age 40 and to continue yearly imaging until somebody's life expectancy is 10 years or less. So really, we want to make sure that you don't miss any cancers, and it really is very important to get your screening mammograms. And by following this protocol, we know that there's the best odds of detecting a breast cancer at an early stage when it can be cured. Just to note that there are some differing opinions in terms of when the exact age to start getting screening is, but our recommendation really is to start at 40.
And to add to that, the age of 40 is for an average risk woman. So if you have someone with a genetic mutation like the BRCA1 or 2 mutation I talked about, or a family history, that's going to be different. The age of which you would start screening may be earlier than 40, and this is when it's really important to talk to your primary care physician or your gynecologist. We also have a high-risk clinic at the breast center. So, if you're unsure, there are people that can help you figure out when you should start screening and with which modality. We also have ultrasound and MRI, which are not part of screening, but are supplemental modalities that are used for additional information if necessary.
So what kind of doctor should I see if I think I have breast cancer?
Typically, the entry point is going to be with the breast surgeon. If you feel a lump, if you have an abnormal finding on a mammogram, you will be referred to a breast surgeon who will guide the workup further. Now, we have a very comprehensive team. In addition to our breast surgeons, we have medical oncologists, we have radiation oncologists, we have nurse practitioners and physician assistants, and some of them run our breast cancer survivorship program. We have a registered dietitian and health coach, geneticist, social workers, and so we have a really big team to help guide people through the process. And the breast surgeon is going to typically then evaluate the case and refer the patient to the appropriate team. What treatment options are available for breast cancer?
So, I think that this question is very nuanced in terms of what stage, what type of breast cancer you have. Typically, when we're talking about including the breast surgeon, radiation oncologist, we're talking about early stage breast cancer, where our goal is to surgically cut out the tumor, whether it's by a lumpectomy, which is just removal of the tumor itself, or a mastectomy, which is removal of the breast. And then that might be followed by radiation therapy, and whether it be chemotherapy or anti-hormone therapy to treat the breast cancer. We do have targeted agents too that we give, and again, the decisions in terms of what treatments to use really vary on the exact type of breast cancer that a woman has.
And there have been some really remarkable approvals, both for early stage and advanced stage breast cancer in the last few years, and the approvals just keep coming. So, we are seeing better outcomes. We're seeing people live longer with improved quality of life, and that really is the goal here. Thank you all for listening. I hope that you found this helpful and had some questions answered about breast cancer diagnosis, screening, and treatment. For more information, please visit our website. We have a lot of information there about our team and the programs that we offer, including our brand new survivorship program. You can also follow us on Instagram at Valley Breast Center, and there's a lot of content on there about nutrition and lifestyle and risk reduction.